about our planning process in Philadelphia. The reason I'm going before Savannah is that we're newbies in this. Our agency, which is the Mayor's Office of Community Empowerment and Opportunity, was created just a year ago. It replaced our old Community Action Agency. We are part of city government, and we are the city's Community Action Agency, but it's been refocused under the direction of Mayor Nutter. And we launched our plan, which is called Shared Prosperity Philadelphia, just 6 months ago, well, now 7 months ago, last July. So we're in the very early stages, and I'll be talking a little bit about our process and where we are with implementation. But I know Suzanne has years of experience, so you'll benefit from that. I'm going to talk a little bit about just an inkling about the problem that we have in Philadelphia and why we thought, just as kind of the stepping back and looking at the totality and how we did that, a little bit about our approach, the strategies that we're focusing on, and what we've done so far with implementation. So, first of all, why? We have the highest poverty rate of the nation's 10 largest cities. We are the 5th largest city in the country. Our population is about 1.5 million. It's actually been growing over the last decade, which is great after years of population decline. But when we did the report, our poverty rate was at 28.4%. From the last ACS, it's at only 26.9%. Still staggeringly high. For children, it's at close to 40%. We also have one of the lowest median incomes. So we're very clear that we have a dramatic problem. And one of the things the Mayor's Office did in preparing even to think in a new way about the issue is to look at what the city was already doing. And we surveyed city and city-related agencies in 2010 when we had the benefit of Recovery Act money, and in 2012. And we were spending that $700 million annually, and that's on about a $3.8 billion budget on poverty-related services. So that was, and that's not, I'm not counting the prisons in there. It's human services, it's health, it's behavioral health, it's workforce development, it's housing. It doesn't include our school district either. So we're already pouring a lot of money into efforts, providing services, trying to help people who are living in poverty, and yet we were not having any kind of specific effect that we could measure in any way. And of course, our numbers are bad, but if you look at them in terms of specific parts of the population with regard to race, gender, you'll see they're worse. So if you're in a Latino household, the poverty rate is 42%. A household headed by somebody with a disability is at 40%, 34% if it's an African American household. So in particular communities, we see poverty rates above 50%. And not that infrequently, unfortunately, because again, our population is growing, and it's growing with millennials, empty nesters, they're coming in, their income is okay, but it's other folks' risk up. And this was just to show that we have, again, 39% of our children live in poverty, and that in the city of Philadelphia is 135,000 children. So it's one of the, just as you think about what you're doing, helping to personalize who this issue is affecting. I don't have the face of a child here, but you'll see faces of children later. It's very important for folks to understand these kids did nothing to work their way into poverty, obviously. So, just again, a year ago, the mayor created a new community action agency, and he actually first thought about the fact that we needed to have a citywide plan to combat poverty. And by citywide, not just city agencies, but engaging all the sectors that Jody talked about, really. The business community would specifically reach out to the academic community, several pediatricians who are great allies now, actually, the philanthropic community, as well as the nonprofit providers who have been struggling all along with this issue, but kind of not getting the attention necessarily or the focus from the city. And we then realized we had a tool, which was a community action agency that, in some cities it's external, it's a nonprofit, in other cities it's part of city government, but that we could use the agency as really the tool to develop the plan and to guide the implementation of the plan. So again, the old agency was abolished, the new agency was created. Our mission is different than the mission of the old agency because we're specifically not focused on directly providing services, but really on this planning, policy, guidance, and evaluation mechanism. So let's see where we are. And again, part of the kind of stepping back, we had to decide what kind of approach to take. And we decided to take an approach of collective impact, understanding that poverty is very complex, that there's not one cause, that there are many different approaches, a lot of what Jody's been saying already, and it's not always easy to measure results. So before I came into government, I organized low-income tenants for 20 years, and how did you measure whether or not rental property conditions were improving or tenants' lives were improving? It was pretty hard to do. And we also wanted to recognize the significant amount of work that was already occurring in the city with partners and potential partners, and we didn't want to develop a strategy that was so unilateral that it would not incorporate all of that good work that was going on. So, how many of you have seen collective impact presentations before? Okay. So I keep repeating, and I have like 2 or 3 slides, but basically it's about uniting folks around a shared agenda, having some shared metrics or measurements, and then continuous communication. So you're communicating out what is working and what isn't working, and that you can make adjustments to your process based upon that, the data collection and the communication. And one of the central pieces to this approach is that you do have a backbone organization, and other folks call it a quarterback, but it's an entity that is doing this work, this communication work, collecting the data, reporting out, bringing folks together in a partnership approach. So that's what we decided to do. And this just shows you, we ended up with, Jody talked about picking your issues. We ended up with 5. Folks with experience in the city of Philadelphia said you're out of your mind, you should pick 1 or 2 issues. And we really had a lot of debate about this. And we also had debate, which I think if you're considering doing something like this in your city, we had debate about whether to identify issues that were going to provide immediate relief to people who are living in poverty, improving access to benefits and getting them SNAP as an example, or EITC, pathways out of poverty, and a lot of cities have focused on that, both early learning, workforce development strategies, being examples, or whether or not we really needed to create, be an advocacy organization and create systemic change. And we ended up deciding that we couldn't exclude any of those 3 opportunities. So, so we are actually looking at 5 strategies, and they span those 3 types of approaches. And for each, we also looked to see if there was a unique role that we could play that nobody else in the community was playing, that people had identified as a need, so that we were adding something to the existing work. Again, Philly is a large city, many players, hundreds if not thousands of nonprofits, universities, et cetera, who are, people who are already working on this issue. And so we didn't want to duplicate those efforts, but a lot of them had experience on the ground, were able to tell us, this is a need and nobody is doing that, and that's why you guys should kind of step in. So, so jobs and training, you go out into a neighborhood, a low-income community, and ask people what they want, and they want a job. They don't want food stamps or income, they want a job. And we said, well, we have a workforce development agency, and we have workforce development funds, why should we do that? And then when we looked at it, we actually realized that for folks who have certain kinds of barriers, they're not being served by that system at this point. So if they, if English is their second language, if they have a disability, if their literacy level is low, if they have a criminal record, they're really not in this workforce development system that we have. We have a great one, it's very robust, it's serving many people, but it's not serving those folks. So we decided to focus really on creating kind of an undergirding system that would work around literacy and kind of barrier removal to get people into even those entry-level jobs that don't pay very well, but from which they can then get into the rest of the workforce development system. And what I tried to do, maybe successfully, maybe not, is to show you that how we organized our report, which is that for each activity, we talked a little bit about what was already going on, recognizing existing work, a little bit about the need. We also put out, we didn't have a timeline per se, but we had what our first year activities would be, and we had metrics for each of the strategies. And some of those still need to be refined, and we're working on that. But again, in kind of the interest of transparency, we wanted to put out a plan that would give folks at least that level of information. So, and again, Jody mentioned this, access to benefits is, we believe, low-hanging fruit, something that we can have an immediate impact on, and we're starting already, I'll talk about it a little bit later, creating or really increasing the capacity of organizations that are already doing this, providing some technology to help screen people for benefits in many, many different locations where they're already going for services. We already have financial literacy programs, and we already have VITA programs, and we're trying to coordinate all of those to improve access to benefits. Learning preparedness. This is where our pediatricians come in. We're also, and this was, again, a conversation for us in the city, whether or not we should take on early childhood education and children being prepared to learn when they enter kindergarten. And we have wonderful organizations that are doing great work. A lot of philanthropists are interested in and supporting this in the city. We realized we didn't have a point of contact within the city for this issue. We had a health and opportunity office, a human services office, a mayor's office of education. None of them were focused on early learning. And everybody around us said we need a point of contact in the city to help coordinate the city resources to respond to and support the nonprofit and philanthropic opportunities that are here already. So we took this on. And again, we're looking at expanding high quality early childhood opportunities, parents' awareness and understanding of that, and kind of trying to drive the demand for those opportunities. Housing security, this is one that's near and dear to my heart. You'll see the chart up there just shows the percentage of people who are housing insecure and that their mortgage or rent burden is too high, and we have, those numbers are high. So, but again, we have an office of housing, we have an office of supportive housing, we have a well-developed system around trying to provide emergency services to people who are homeless or near homeless. What we thought we could add to that conversation was helping prevent homelessness and trying to wrap services around the housing work we're already doing. It's more and more expensive to develop new affordable housing, and frankly, we don't need to do that so much as prevent people from falling out of the housing that they're in now, or improving the quality of the housing that they're in now, or enforcing existing regulations. So one strategy we have here is just we have 20 organizations that are funded by the city to provide housing counseling. It's wrapping other services around that housing counseling, or in the affordable housing, providing health and other services, wrapping those around as well. Actually, one of the organizations that's doing a lot of work around housing right now is our Department of Public Health, helping low-income families whose children have asthma or lead paint poisoning, and therefore they are at risk of losing their home, but we can help them stay in those homes and make them healthier. And then economic security, and again, Jody mentioned this in terms of financial literacy. We're one of the cities that has the benefit of a Bloomberg Philanthropies grant to have financial empowerment centers. We've just finished our first year, and they've been remarkably successful, providing one-on-one financial counseling for free to anybody who walks in the door. We've served over 3,000 people in a year in 7 different community-based sites, and we really wanted to just continue to build upon that work, and also work with our banking institutions to create better opportunities. A surprisingly high percentage of Philadelphians are not using banks. They're going to payday lenders, and one of the reasons that they are is that they have more clarity about what the fee schedule and structure is, and they understand it, and they don't to the banks. So trying to work with banks to create different kinds of products with even better information, so that more folks will be in a safe banking situation. Those are our 5 strategies. We're not doing everything at once because we can't, and I'll talk about that for a second too. Part of what we did after we launched the plan was to think about how to continue and improve the planning process. And so, and we have had people knocking at our door with joy that the city is recognizing the issue of poverty and trying to take a leadership position and wanting to be a part of it, even in the absence of any significant new funding, I will say. We administer about $5 million of a federal grant, and that's it. We're trying to raise more money, but again, even in the absence of putting new money on the table, folks are very, very eager to work with us and to align with us, and we had to keep that interest and that momentum going. So we created what we call roundtables. We've only had 2 so far, but on a monthly basis, we're bringing people together to educate ourselves and create partnerships around issues around poverty. Had 60, 70, 80 people show up at these. One was around access to benefits. The other was about place-based strategies. But just anybody who wants to come in the door, first come, first serve. We're bringing in our researchers to help educate us, and we're bringing people together who haven't met each other to make connections. We're also creating a learning community in each of these 5 areas, and those learning communities will be diverse. They will include consumers, researchers, philanthropists, business, as well as providers, and they will guide the rollout and really the implementation of the plan, to help us create more specific timelines, metrics, and programs. And then we were overjoyed just 2 weeks ago to learn that we had been selected to be one of the nation's first 5 promise zones, doing our, really implementing this strategy in one particular neighborhood in West Philadelphia. So it's an opportunity for us to take the whole coordinated strategy and work with many, many partners in one neighborhood, and I think it will give us a great way to judge the work and its impact and help us make adjustments kind of on the ground right away. And what we're doing with our existing resources, I just thought this might be helpful in terms of like first steps out of the box. As I said, we have financial empowerment centers. We support VITA sites throughout the city, and we're trying to line them up with our financial empowerment centers where we can. We have just are finalizing a process to create a citywide common tool for screening folks for benefits. It's a web-based tool and an organization that can help us collect the data and track it. And we're trying to set up in existing community-based organizations that will help folks work through the benefits process, which can be very difficult, and other organizations that will make referrals. So we're trying to create, again, we have hundreds of organizations serving low-income people. We can give them this tool for no cost, train their staff, and provide backup and support. So if somebody's coming in around energy counseling or housing counseling or health needs or any of the other services that they're going for, they can also get a benefits screening at the same time, and we can roll all that data up and provide support. On the jobs and training front, we're experimenting. We're trying to push 2 well-known providers of job training that are working with particular manufacturing sectors to reach down deeper and to serve folks who they are not currently serving in their training program. So reducing some of those minimum requirements to get into the training program. And one is in the healthcare sector, and the other is a group that works with the consortium of anchor institutions, eds and meds, in West Philadelphia. So we're trying to get them to, instead of requiring the GED or the high school diploma, maybe work with somebody who's not there yet. We're starting to fundraise. That's what identifying new resources means. And then we're trying to coordinate in the city in general on our place-based strategy. So we have, in addition to our promise zone, which is in West Philadelphia, we have a choice neighborhoods application in another neighborhood, and we're part of that and have to put resources on the table if that's successful. And we also have a Department of Justice grant around preventing adolescent violence in one specific police district, and it's actually led by our family court, our police commissioner, our human services commissioner, but we're in that community as well and have agreed that to the extent that we are putting resources on the table, we're going to put them in that community as well. So collaborating with other city entities and with the nonprofit sector, the philanthropists who are supporting that work. So that's about 6 months of work. I hope that when we are however many years old now, the Step Up Savannah is, a dozen or so, that we will be in the same places then and we'll have evolved. Just one other thing, I have about 15 copies of the executive summary of our plan with me today, and I don't want to carry them back on the train, but I don't have enough for everybody. So I'll put them out on the table, but our website is up there, Shared Prosperity Phila, so, and it's full of resources and things that we learned, so hopefully you can learn from them as well as from Joe's. Thank you.